And there's actually something very beautiful about taking full responsibility, just allowing yourself to be human and having erred and made a mistake, right?
This season, Ripples, Physician Wellbeing will focus on the theme of facets of compassion. Compassion for self, others, and society. The Long School of Medicine Office for Graduate Medical Education utilizes a compassion course to combat feelings of imposter syndrome, guilt, or shame with challenging patient outcomes, as well as teaching mindset adjustments to promote higher self-kindness. For each facet of compassion, we'll provide you with an episode about recognizing when an instance can require grace and the Pebble to activate it. We're happy you're with us. Let's create some ripples.
Hello, welcome. Gosh, we are already here on the third episode of Compassion Course. And today we are going to be talking about emotional awareness. And we have a special guest. John, I'm going to leave it up to you to introduce our special guest.
Oh, great. Yeah, this is a delight. Lindsay Bira is a good friend of mine. She's a PhD psychologist who did her training in Boston at Harvard and Boston University, and then got her PhD in Miami. And she's an amazing person. And to give you some idea, she's been recorded on National Public Radio, interviewed. She's have articles in Science, Nature,
Yes.
Fortune, Women's Health, and as a TEDx speaker. And I could go on, but then we wouldn't have any time for the podcast. So with that, we're going to go ahead and get started. Welcome, Lindsay.
Thank you so much, John. It's honestly a pleasure to be here. It's always special for me because I'm still adjunct as assistant professor of psychiatry here at UT Health. So it's great to contribute back to the resident wellness initiatives.
And you do a huge role in that, so we appreciate
Thank you.
it. Talk to us about what it really means to have emotional awareness.
So, I'm a clinical psychologist, and I care about this for multiple reasons. One, I specialize in trauma, and then I also specialize in behavioral medicine, which is why I've done all my training in hospital systems, and I'm here at the medical school as well. And when I think about why emotional awareness is so important, it's because our long-term predictors of health, so the things that are actually going to kill us in the long term, cardiovascular disease is number one. What that relates to is how we're living on a daily basis. And emotional awareness is the first step to emotional regulation. And emotional regulation helps us regulate our nervous system and all those chemicals and the inflammatory markers that, if left unchecked over time, that's what causes us some chronic issues.
And I think there's some studies that show that people with higher levels of emotional intelligence actually do better in jobs. Like they rise up promotions and things than people who are super intelligent.
Absolutely. This is when I first started speaking on emotional intelligence, and I kind of switched from the disease and disorder model of treating patients and being in therapy groups and leading those to talking about resiliency. This was some of the coolest research that I found on emotional intelligence. And researchers went into some corporations in the 90s, and they were looking to see what predicted success. And they thought they were going to find that it was IQ. But when they actually looked, it wasn't the people who were highest in IQ that were at the top in the leadership position. So they said there must be something else here. And when they kind of dug through, they then defined this term emotional quotient, EQ, emotional intelligence, to capture those people skills and those leadership skills. And they found that people who were high in emotional intelligence were outperforming those who were high in standard IQ 70% of the time.
Wow.
They also were making about $30,000 to $40,000 more a year in salary than somebody who is high in IQ. So that's when everybody started to pay attention to what is EQ, what is EI. Emotional intelligence is very important. And what's very cool about that is it's a soft skill that we can all develop. There's a little bit of a hard skill about it. Some people are just born with those skills by nature. But what I think is just very cool is that we can foster that and teach people about it and then practice things that help us improve.
There's actually a book that we recommend to a lot of residents called Emotional Intelligence 2.0, which speaks exactly about the way to gain some of these skills.
Yeah.
The soft skills are so important. There is so much awareness about soft skills in people, and that gets them to higher levels.
Yes.
Yeah, that's so important. So you have been mentioned that practicing emotional awareness allows one to easily regulate their emotions, keeping the sparks and experience from turning into wildfire, right? I think it's such a nice way of talking about this.
Yes. So, and this is especially important in the medical field or any type of field where you're working one-on-one with people, especially if it's somebody who is having a difficult time, like a patient, or has a difficult kind of trajectory that we're having to manage. When we think about emotional awareness and emotional regulation, it's basically the trajectory to how big our emotions are going to get. And we know that emotions are then connected to behaviors. So it's about behavioral control too that makes us very effective in situations. And so you kind of mentioned that metaphor of the spark turning into a wildfire. So when I think about that, I then also think about, being inefficient in a workplace or in a role versus being very efficient. And this goes back to the high EQ is a leadership skill because you're able to manage yourself and manage other people, and that's emotional intelligence. When we kind of think about what we can all do to help develop this, the first step, and this is what I tell my patients whenever I work with people one-on-one in my private practice, is the first step is just understanding what it feels like in your nervous system when you have that upheaval of, oh, I am angry, or this is not okay, or I'm sitting in front of a patient who is still not doing everything that I suggested to them, and just talking about the issue that I'm not immediately able to solve, and I feel what that feels like in my nervous system. That's our first cue. And so we have so much power. It's almost like the first link in the chain or the first tick in the trajectory that if we can notice that and then sit with it, we're immediately pulling our frontal lobe online and better able to control our limbic system, the amygdala, and that whole stress response.
What's really neat about that is this ties in exactly with our last episode, which talked about mindfulness and meditation. And we talked about the idea of that period of time between stimulus and response.
Yes.
And moving out of your amygdala or lower brain and into that right prefrontal cortex, the idea of I can make a choice how I respond to that stimulus.
Buffer zone. And widening that buffer zone. That's what I think the key point in time there is, that buffer zone between that thing that I feel in my nervous system and what do I do to create more length in that buffer zone before my immediate reaction. This is why the breathing can be so helpful.
Yes, yeah. And also the creating a little bit more space to respond.
Yes.
So I think this next question will kind of dovetail perfectly into that, is the idea that some people can have harmful mental states, but also people can have beneficial mental states. Can you talk a little bit about what those are and then how we can help kind of nurture more of the beneficial mental states?
When we have a group of high performers, which tends to be, who medical students are, medical residents, anybody who's really pushing themselves to achieve more, we see features of beneficial mental states, but we also see a lot of the perfectionism, which is the detrimental mental state. Perfectionism and having big high goals for the self or ideas about how things should be, which makes us less tolerant of reality, especially when reality slaps us in the face, right? Yes. It's when we're holding on too tight to that perfectionism model or those ideals and we can't really digest the reality. It's that gap between the reality world and those ideals that we're holding on to that causes the suffering. And we see that spoken about, across time, and Eckhart Tolle and all these kind of thought leaders will talk about that's where the suffering happens. But when we look at these detrimental mental states that we can all examine within ourselves, it's when we start to fight against reality. I think, high performers, high achievers have a strong self-concept, but that can break down very quickly when things aren't going well because it doesn't match that high-performing self-concept. When somebody gets in trouble, when somebody makes a mistake, this is something that we talk about in these modules, right? It's the guilt and shame that can happen so quickly when we make a mistake. And that's part of that emotional awareness. If you can understand what guilt immediately feels like in your body, and you understand operationally what guilt is and why it probably doesn't belong to you, then that's where you can take that breath in that buffer zone. You're highlighting the physiological response. You're spending time before you react and getting frontal lobe based with it. Yes. So getting really critical in a positive way about your own process. And that's how we break out of some of those detrimental mental states.
Yeah.
Wonderful.
Beautifully said.
Thank you.
And then so every time, if I understand, it's like you bring your prefrontal cortex to be present and working
Yes.
for you rather than going into fight or flight response.
Yes, and I firmly believe that we need tethers so that our prefrontal cortex has something to hold on to. Because I think we all know the experience of where we're having a big emotion or we are upset, but we cannot logically think through it. It's like you know that you want to stay calm and controlled, but you just can't get that online because your limbic system is so engaged. And so I think especially for logical people too, there has to be some type of framework or roadmap that you've practiced beforehand so that you can grab onto that or tether onto that. And that helps solidify the connection with the frontal lobe and then helps you spend time in that buffer zone.
Yes. Yeah. So you need something to hold on to.
Yeah, it's like
And
knowledge
that's-
or a tool or a definition
yes.
that you're like, oh, this is that thing again. Which is why therapy can be helpful, why emotional intelligence training, why podcasts like these can be so helpful, because it's already a kernel that starts to plant itself and then gets you to think a different lens about yourself or your workplace. And then when the thing happens and the limbic system tries to take control, you already have something to tether onto.
And then I also know that you mentioned about regret versus guilt. And then as far as I know, when you say about regret, when we regret about something, that means we value something about it. Whereas guilt is not the same. So please explain that to us.
To take a step back, so where this comes from is my training has been both in behavioral medicine, but also PTSD and trauma. So for many years, I was a contract psychologist for the military working with combat PTSD. This concept is directly pulled from a top evidence-based treatment called cognitive processing therapy. And there's a whole module around guilt, regret, and shame, and also responsibility. And so, this is kind of a little bit of a story about my path here. But as I was treating combat PTSD and civilian PTSD, sexual assault trauma, all types of trauma, doing this guilt module, I was also thinking, this happened to me so much on my path, why are we waiting until the thing happens, the trauma happens, and all the difficulties after it to then deliver this information? Actually, what this education is resiliency training or emotional intelligence training, which is why I started to take the guilt and responsibility and regret and shame concept and pull it to different groups and give these resiliency talks so that before the trauma happens, we have this tether. So this is one of my favorite things to break down. And I think for me, as a high performing person, a perfectionist, a lot of my life still battling some of that, self-disclosure. Aren't we all? Right? Exactly. It's a lifetime growth thing. So, this is something that also hit home with me personally. I thought, oh my goodness, I am hard on myself and I feel guilty quite often, but that's not even mine to own. And now I understand why, and that empowered me. There's a handout on this that we're going to give the residents later, and that I love to kind of break down, but it basically goes in these different tiers. The first level is something that's just an accident. Nobody could foresee that it was going to happen. God or source did not part the clouds and say, yo, watch out for this thing later. Just, we couldn't have prepared, right?
Sure.
That is an accident, and the natural emotion is grief and sadness, just some loss about, what we lost through that. The second layer is responsibility. This is where we were involved in a situation where we may have neglected a responsibility that arguably we had. And so because we neglected that responsibility, we probably contributed to the bad outcome in some way. Maybe that's measurable, maybe it's hard to measure, but we know that we neglected a responsibility. Okay, that's the responsibility piece.
And you talk about like looking at your cell phone while you're driving because
Yes.
somebody texts you and somebody walks in front of your car.
Yes,
is
great.
a great example.
We'll weave this in. Thank you, John, for that. So the example here is you're driving down the road, right? And somebody pops out in front of your car and you hit them. Horrible, right? If you were doing everything right as a driver and everything was working right and somebody just popped out from in between two cars, that's an accident. And it's going to be very sad. You're going to have to grieve some things that you even went through that situation, but you're not going to be held responsible and you're not going to be found to be guilty, right? The next tick is the responsibility category that we were talking about. That's where if you're texting as a driver, so you're driving down, you're texting, you look up, somebody's in front of your car, you hit him and kill him. Horrible. Right? Now it's a little bit different. So now your text records are going to show that you were texting, so you were neglecting responsibility. The key thing here is you did not intend the harm. So that's going to be found as they go through in the court system. They're going to say, well, this wasn't a voluntary thing. You didn't mean to do this, right? The other thing that we need to look at when we neglect a responsibility is why did we neglect it? And what other factors were involved in this situation that might have contributed to the outcome? This is what we call the responsibility pie chart. We can literally break down every single person and thing involved and look at what responsibilities were neglected, because usually it just doesn't happen in a vacuum, right? And if we ask why we were neglecting a responsibility, we can usually peel off layers of guilt and shame that happen with that, because there's things that come in. I was driving yesterday. Actually, I was Ubering. This is why I could look out the window. I was Ubering and was observing out the window on a highway. And almost every car, the people were looking at their phone. Almost every car on the highway. And I just thought, wow, this is so common, right? Number two, most times bad things don't happen. It's actually pretty significant that all these people can be texting on the highway and yet no accident happens, right? So this is one of these things as an example. We should not text and drive. It's illegal to text and drive, so everybody be on your game. But if a bad situation like this would happen, we can't overly demonize ourselves, because we live in a world where these things are normalized, right? However, we have to take full responsibility, and there's actually something very beautiful about taking full responsibility. Just allowing yourself to be human and having erred and made a mistake, right? Now, the next one down, so again, we have 4 of these layers. So responsibility is the second. The third is guilt. This is where true guilt and blame applies. So somebody should feel guilty. This is where there was an intent of harm. So if somebody's driving down the road and they see their ex and they hit them on purpose, this would be a guilty situation. This is voluntary, manslaughter. So the court system breaks down all of these details and spends a very long time doing that. It's interesting because we as humans, we don't spend a long time doing this. And there's procedures in place and institutions to really look at all these variables, thank goodness. But on a personal level with ourselves, and this example is very extreme and a legal example, but on a micro example, the daily things that we do that we don't do right, we do not look logically at all these variables.
That's
we
true.
tend to just have that feeling and then carry that feeling with us and get lost in it. And then it's a feeder into depression, or it's a feeder into anxiety, right? So if somebody did not intend the harm, then guilt does not apply. Now, here's the cool thing about guilt too. Sometimes we do intend the harm. Sometimes we get in an argument and we say something because we knew it would get to somebody, right? Hopefully that's not happening too much, but we're human and that might happen. If we feel guilt in association with that, then we still have that logical roadmap. Okay, I did kind of intend that harm. The next step is all we do is we take responsibility and we apologize and admit that and say, that's not how I want to be. Go back to values. You mentioned values earlier. That's huge in this area. So it gives us a little roadmap out of it, right? We can always apologize. We should not be living in guilt. It should not be around for longer than a few minutes, few hours, or a day until we can take an action. The last one is shame. So guilt is about something that I did. Shame is about who I am. So I am a bad person at my core. I am broken and damaged, and this thing that just happened is making me feel that way. Literally nobody should be feeling that way. The people who should be feeling that way, I think neurobiologically can't feel that way. It's just like, sociopathy or something. So nobody should be feeling that level of shame. If somebody does feel that level of shame, you got to get your tether and get the roadmap out of it. And then maybe you do need to issue an apology or take responsibility. But by having all of this mapped out, we can then climb back up that ladder and appropriately place the situation in one of those boxes, no matter what it is, a small mistake or a larger mishap.
Yeah.
This is so important for residents, because just in the process of their daily work with patients, mistakes happen. They oversleep. They don't look at a lab that they should have, and harm actually happens. And everyone instantly feels profound guilt.
Yep.
And then they carry that with them sometimes for years.
Oh,
they remember
yes.
patients they harmed 20 years ago as a resident.
Yes.
And this is so valuable to say, did you intend to not look at that lab and harm to happen?
Yeah.
Then you should regret doing that, but there's not guilt.
Absolutely.
So valuable for residents and physicians.
Yes, and the regret piece, I didn't mention that, but yeah, regret is about living in the past a little bit and wanting to undo the action, which is part of taking responsibility because you can see what could have done or should have been done. However, we can't be living in that because there's no way to move backwards, as we know, right? Life is continuously, no matter what happens, we have to keep moving forward.
Yes.
So we don't want to spend too much time in regret. It is a part of responsibility. It's also a part of guilt, but we also don't want that one to stick around too much either. I think this conversation is so powerful because we also know there's literature on reducing litigation risk, lawsuit risks for physicians and in hospitals. And if we have a culture, a non-shaming, non-guilt culture, so where the attendings and the leadership are having these kinds of conversations about guilt and shame and why we need to let go of it and why taking responsibility is a powerful, empowering, and beautiful thing, then we've shifted the culture. And then we have better patient-centered care, better teams, and then litigation risk is actually reduced.
Once we provide psychological safety in the system, people will be able to converse and feel guilt, and then they would turn it into some type of action where they take responsibility.
Yes.
And
even expressing that to somebody, saying, as a resident or a medical student, saying, I'm feeling so guilty right now because of what happened today, and I played a role in it. I'm trying to figure it out. Having that psychological safety to talk to a higher up in that way, and that higher up to have the roadmap, the tethers, the tools to educate and create that ladder. What a beautiful thing.
I keep coming back to tether. John, when you were talking about all this, if somebody hit someone as they were driving, they didn't intend to do, maybe you looked at all the other aspects of their life, domains of their life. Maybe he had a bad day. He wasn't thinking about, he was not looking.
Thank you for bringing it
to that, right?
Exactly. And thank you for bringing it back to that because there's one more piece that I forgot to say. Yes, why was this happening? Distractibility, maybe there was an issue that you had to pay attention to, right? There's many reasons why we choose to text, and not all of them are just scrolling through Instagram. I think most times it's not, well, hopefully. But here's the other side of the story. The other variable in this is the person who stepped in front of the car. And let's say after evaluation of this situation, they found out that that person was waiting for the next car to step in front of. This changes the whole scenario.
Yes.
So even if you were a texting driver and you were held responsible in that way, somebody else intended the harm and they tick into that guilt and blame box. Does that make sense?
Yes.
So then even in the court proceeding, the texting is an irrelevant factor because that would hopefully be found. So this is why it's so important to be in the frontal lobe space so that we can actually break down all the variables, because otherwise we just overly put blame on ourselves and we get stuck in that. That is a trauma response. That is amygdala activation, and it's like a loop. It's like you're stuck in a loop. We can probably take a moment and think about those things that like keep us up at 2 a.m. when we can't sleep in a stressful time that relate back to decades ago, kind of like you referred to earlier, John. It's like that thing that plays on your mind that falls into one of those categories that we say, oh, I'm a bad person, or oh, I can't get it together, or this thing happened and I shouldn't have. It's like that right there is what needs to be plugged into the model, because that's the amygdala loop, even if it's on a minor level, that we will have so much better emotional well-being if we can shed that layer.
Yes. And you're almost talking about not emotional intelligence. I'm so tempted to say emotional wisdom is what you're teaching, really.
I love that term.
Right? Yes.
I love that.
We always like somebody to leave us with a pebble, some sort of tool or practice or perspective that they can take and use in their daily lives. I'll ask you what your pebble will be. I know you thought of several, so.
Yeah. What I would say is, for everyone listening, if you do get caught in that guilt cycle, put a big pin in that. Now you know. Once we know, there's no going backwards. We already established that on this episode, right? There is no going backwards. So you've heard the information. You've gotten the tether. Now it's your responsibility to remember that and put that into practice. So the next time that you are laying up at night or you're at work and something has happened and you feel that in your nervous system, and observe, where is that ticking down into? Is it ticking into the guilt spot, or is it going down into shame? Now you have those definitions. And so your responsibility in that moment is to tick back up. Now, second piece of this is sometimes it's very hard to do that. So we have to have a nervous system hack. One of my favorite hacks with breathing lately. We know breathing is a direct hack into the nervous system, right? We have, the slow diaphragmatic breathing. We have the box breathing. There's so many different types of it. If you follow Andrew Huberman, he has delivered the physiological sigh, which is breathing in with a little puff at the top, holding that full breath of air, and then out. And we know even making a sound whenever we sigh cues our brain to relax even more. Yeah. So in those moments, we can go, and that immediately, neurobiologically, if we were in an MRI, we would see a shift into which part of the brain was functioning. Amygdala would get quieter, limbic system quieter, and our frontal lobe would come on a little bit more. So if you just do 3 of those in the moment that you feel that you're in that pattern, then you will have better frontal lobe activation, and you can tick through those boxes a little bit more easily.
Wow, what a great pebble. And one that lasts 4 seconds, 5
so
seconds.
quick, and you feel the difference in your body. And you also start to realize how you've been shallow breathing so consistently with tension, right?
Yes.
And you're like, have I been spinning my breath like this all day? And you get to relax, and then your brain is working better, and you get to pull yourself out. Yeah.
Love it.
And you could do wherever you're standing, you're with patients, you just nobody notices you're taking this deep breath.
Yeah.
2.
Yeah, you can even teach your patient that. You can say, you know what, I'm noticing I'm feeling a little bit tense right now. Before we get into this conversation, I'm going to teach you a tool, and let's do it together, right?
Yes.
What a cool interaction.
Absolutely. Another tether.
Yeah.
I love it.
I love it.
That's the theme for the day, tethers. Lindsay, this has been outstanding. Thank you so much.
Guys.
So wonderful.
Thank you for what you've created with this podcast and this conversation.
Ripple's Physicians Wellbeing is made possible by the Joe R. and Teresa Lozano Long School of Medicine Office for Graduate Medical Education. To contact us or learn more about the Wellness Home, visit gmewellness.utesca.edu.
This podcast is inspired by the Dalai Lama's powerful quote. Just as ripples spread out when a single pebble is dropped into water, the actions of individuals can have far-reaching effects. We provide physicians with pebbles, tangible and actionable practices that can help make positive impacts in their personal and professional lives.